We are basically thankful to starting from the press who had made the days of March 7th and March 8th help us to conduct a free camp for women on the occasion of Women's Day on March 8th, 2014. In this free camp, we had seen about 250 patients, most of them women, in fact all of them women, who are suffering from orthopedic problems, most of them with knee pains. 50 out of these patients were suffering from severe knee pains from a long time and were unable to walk, unable to do their activities of daily living, unable to cross stairs. These patients had volunteered, had agreed to get operated the preceding week, and out of them a lot of people decided that March 12th, a Wednesday, as well as March 14th were very good days, auspicious days, which they are very particular for in our country, in this part of the country especially. So that preceding week we had operated on 50 patients, we had done 65 knee replacements. It comes out to these figures because many of them undergo both knee replacements at the same time. In this, because it was an auspicious day, on March 12th, the Wednesday, 20 patients were operated. That day we had done 30 knee replacements. So 10 patients underwent both knees and 10 patients underwent only one side knee replacement. We started from morning 5:30 and we winded up, the last patient was wheeled out of the operation theatre at 6:30. So in 13 hours we had done 30 knees. This is common in a few centers in India. Large numbers are done on a single day because the entire team with its due diligence works toward it, and surgeons like us with our expertise do a knee replacement in 35-40 minutes totally. So we do a knee replacement in one OT, go to the next OT, go to the next OT. We keep hopping between operation theatres, putting the knee inside, checking everything is right, and go to the next operation theatre. The whole team was geared up, nearly 200 people was geared up to take this massive numbers, not only on one day on a Wednesday, but also on the next day. We are thankful to all the patients who have come forward and shown their faith in us. We are thankful to the entire staff of Srikara. Unbelievably, they have worked. This kind of organization and this kind of team spirit is very rarely seen in places. So we thank them from the bottom of our hearts, and definitely our orthopedic surgeons, our anesthesia team, our critical care team. Each and everyone we thank. Even I should thank people right from our parking who have been involved, our security people who have been involved in parking and taking such a lot. We thank the attendants of the patients because on one single day so many people are getting operated. They were so cooperative, they stayed back in their rooms, they just came back and after the surgery saw their patients, were very happy. There was no dissent or discontent from their side. In fact, the kind of encouragement and support they have given, it would not have been possible because of them. Each and everyone, we thank you, especially the patients, the press, the patients' attendants, and the entire time of Srikara. We thank you, and we want to serve people more with this kind of spirit. The success rate is nearly 100%. Now, almost 90% of our patients have been discharged on the 4th day. They have gone home after they have walked to the corridors, they have gone to the bathroom and come back. So they have been doing very well. Their happiness is our happiness. Knee replacement is a 99 to 100% successful surgery in history of any surgery. It is one of the most successful surgeries. Only the patients have a 0.5 risk of carrying, 0.5% risk of getting an infection, which is now coming down. It will not be totally eradicated, but is further coming down because of the precautions we take.